dysfunction and urinary incontinence. The magnitude and the commonplace of these two problems is probably understated, in that many more women are suffering from these conditions than are being treated for those problems. We need to make sure that we have a safe place where women can come and talk to us about their most intimate concerns and know that they're going to be addressed and treated. So how do we do this here in our gynecology office? We use a comprehensive, multi-modality approach to making sure that we get resolution of symptoms of urinary incontinence and female sexual dysfunction, all without surgical intervention or general anesthesia and all of those risks. So when does female sexual dysfunction and urinary incontinence start? It's different for everyone. Anyone can suffer from either or both of these two conditions. I will say that they are much more common after vaginal childbirth. Vaginal childbirth is a very traumatic experience for the pelvic floor, the musculature, the nerves, the connective tissues that surround the urethra and the vagina. For that reason, a lot of women are left with changes in sexual function and changes in urinary function long term that are detrimental and difficult to deal with. So as we use a multimodality approach, we're going to treat the entire body with different types of therapies that are additive. When we treat the same problem in two different ways, we're going to get an additive effect. These problems, typically urinary incontinence has been treated with caffeine restriction, with surgery, or with prescription medications, or with biofeedback therapy and Kegels exercises. Now, can we get resolution of those symptoms with all of those things? Yes, absolutely. But we're talking about general anesthesia. We're talking about surgeries that have risks. We're talking about exercise therapy that is long-term. We're talking about medications that have side effects and that are prescriptions. It's probably not the best way to go for women long-term, especially when we have so many different options right now that work so well. Female sexual dysfunction is something that, when I first started practicing medicine 20 years ago, was extremely difficult to treat. It required psychotherapy, perhaps herbal supplements to improve libido, or over-the-counter lubricants to try to decrease pain. Some hormone therapies helped. But the reality of it was, for many problems with female sexual dysfunction, we never really talked about it because we really couldn't help you that much. And that's unfortunate, and it's not a good thing for the medical profession. So, with female sexual dysfunction, as testosterone levels drop in women after childbirth and from their 30s and beyond, libido oftentimes decreases and never comes back. Certainly if there is pain with intercourse or lack of lubrication, there will not be a libido. Your body will not want to do something that hurts. So lack of libido would be expected in people who suffer from pain with intercourse. So we have to get rid of that pain. We have to make sexual function something that is pleasing and pleasurable. Female sexual dysfunction damages long-term relationships, and it damages the self-confidence of the women that suffer from it. So let me tell you how we treat this. BioT hormone therapy. Hormone therapy both for men and women, but testosterone therapy will improve libido and sexual response in over 90% of women that are treated. When we use testosterone, we use subcutaneous bioidentical pellets. When we use estradiol, we significantly improve the blood flow and the thickness of the vaginal lining, essentially removing dryness completely and removing pain with intercourse. So hormones play a big role in this. We should not be afraid of hormones. Testosterone and estradiol have been made by your ovaries and your adrenal glands since you were an embryo. If those two molecules were dangerous for you, you would have never made them in the first place. Or they would have evolved out of your system. These are good for you. They help you. Number 2, Diva by Cyton is a vaginal laser that will essentially rejuvenate and recreate new vaginal tissue, turning over the vagina, creating new vaginal tissue. We do a series of 3 treatments. They're 4 minutes long each, with just a little topical anesthesia gel and minimal discomfort. No downtime. You can drive to the appointment and drive home. Diva Vaginal Laser treats lubrication, treats pain, has proven to increase the client's ability to reach orgasm. also has significantly decreased urinary incontinence. We also know that estradiol in the vagina lowers urinary incontinence as well. So we're treating these same problems with multiple modalities. Diva also treats vaginal laxity. Vaginal laxity from childbirth can lead to decreased sensation and decreased ability to climax or reach orgasm. Diva has been shown specifically to decrease laxity as noted by patients and their partners and make it easier to achieve orgasm. So, BioT and Diva, the first two steps. Now we have OSHOT, platelet-rich plasma. It's your body's own serum that it uses to trigger regeneration and rejuvenation of tissues. We use your body's natural abilities by waking up stem cells and releasing growth factors to rebuild tissue in the areas where they're supposed to be. When we treat around the urethra, we treat urinary incontinence. When we treat vaginally, we help with sensitivity, decreasing pain, increasing lubrication. The sensitivity is improved both externally and internally with intercourse, increasing the woman's ability to reach climax. All of these things are treating the same problems with different angles. The effects are additive. Okay? IMSILA is a new device from BTL that is an electromagnetic chair that women sit on, fully clothed, for 28 minutes, twice a week, for 3 weeks. What this does is it sends an electromagnetic pulse of energy through the pelvic floor in a circular area about 10 centimeters and up. Patients sit on a chair, read a magazine, watch TV, fully clothed for this 28-minute session. There is no pain with this, but the electromagnetic energy will stimulate muscle contraction of the entire pelvic floor, and this includes the muscles alongside the vulva and on the perineal body, all around the opening of the vagina, and around the urethra and around the vaginal canal. When these muscles contract and get trained, it strengthens them significantly, so that when you're about to sneeze or cough, you can contract those muscles and hold it in. Biofeedback therapy or Kegel's exercises is something we've done in our office for decades. If we work with a patient for 45 minutes and help them contract those muscles, we might get a good 15 contractions out of that patient. Okay? When you sit on an IMSILA chair for 28 minutes, there are over 11,000 pelvic floor contractions during that period of time. Now, in addition to there being that many more contractions, they're also that much stronger, in that when the pulse of energy is sent to the muscle contracts, but before it has time to relax, it is hit with multiple more pulses of energy. So the muscle contracts and contracts and contracts and contracts again. That is what we call a supramaximal contraction. So the muscles are contracting stronger than you could contract them yourself, and they're also doing it thousands of more times. Is this better than biofeedback? No doubt it's better than biofeedback therapy. So I think that by adding all of these together, IMSILA is going to improve laxity and sensation and also control the urine. All of these things overlap, and it is what we call our total package for treating pelvic floor function in women. That's sexual function, that's urinary control, and to a certain extent bowel control with the pelvic floor therapy here. So I hope that you've learned a little bit about the way that we attack and manage and resolve and treat patients' problems like this. In our office, I have ladies that work with me that are experts and trained at this in multiple different modalities, and we are all available and willing to talk to you about these very intimate problems in a safe and professional atmosphere here in our office. We've treated thousands of women with these modalities, and the good news is now there are almost no non-responders. These problems that we couldn't treat for decades, we now can not only treat, but we can help just about everyone gets better with what we're doing. And that's exciting, and people should know about that. So I hope you've learned a little bit today about these things. We do have a website with some other videos specifically talking about these, and I hope you'll visit that. So please call us or visit our website and come in for a consultation. I would be honored if you would let us help you with these problems, because you don't have to suffer in silence anymore. Thank you.